Hello, everybody. Welcome. My name is Garrett Schmidt. I am the managing editor for ACOExhibitHall.com and wanted to welcome you today to the webinar hosted by HealthCrowd titled The New Key to Closing Care Gaps, Digital Patient Communications. And we're very excited. We've got a lot of great things to cover today. A few items of note before we get started here. Everybody has joined in listen-only mode, so you don't need to worry about muting your mic. That has been done for you. And also, the webinar is being recorded, so afterwards, what I'm going to do is I will be sending out an email to everyone who has registered, and that will have a link to the recording as well as a place where you can download the slides. And so you can expect that from me. And we hope that you share that with your friends and with your colleagues and review that as often as you would like. And then finally, during the webinar, we are going to have a time for Q&A. So we hope that you participate in that and would love to hear from you. Now, you don't have to wait until the Q&A in order to ask your question. You can go ahead and put that at any time into the question module that you have there. And we look forward to hearing from you. So thank you for joining us. So today, our speaker is Jackie Maynard, and she's the VP of Digital Communications with HealthCrowd. So welcome, Jackie. And I'm going to go ahead and turn it over to her at this time. So welcome.
Well, thank you. Thank you, Garrett. And really excited to be here and appreciate ACOExhibitHall.com creating this opportunity for us. So good morning, everybody. I am Boston-based, but I am talking to you today from San Mateo, California, which is where HealthCrowd is headquartered. My first trip to the office in a year and a half since COVID started. So as Garrett mentioned, I'm Jackie Maynard. I'm the Vice President of Digital Engagement here at HealthCrowd. I started out my life as a social worker, but have been in healthcare for about 30 years, came up as a case manager and various roles over time, and particularly passionate about technology in healthcare and how we use that to really create effectiveness, helping people, remain healthy, stay in their homes, get access to care and things like that. So hopefully some of that experience will help answer some questions today. All right. So the agenda, I'm going to give you a very quick overview about HealthCrowd, who we are. But I wanted this presentation to be very educational for you, and I am happy at the end to answer any questions you have or speak to you offline if you have specific questions about your organization and your communication strategy. So today we're going to talk about the opportunities for communication with members, the types of outreach, compliance and effectiveness, communicating in a natural way, outcomes, and then we created a takeaway checklist for you. And then we'll do some question and answers. All right, so as I mentioned, HealthCrowd is headquartered here in San Mateo, California. I'm a Boston girl, as you can see from my Dunkin's cup of coffee that fortunately I was able to find here. We've been in the digital communications and communications orchestration business for many years. And one of the most exciting things that happened to us in the last year was that we became HITRUST certified. And I think that's important to mention because anytime when you're talking about data that needs to be shared with organizations or communications, anything that's member or patient related, it's really important that you can trust that data and that information is safe. And so becoming HITRUST certified was a big accomplishment. It's a ton of work. As you can see, we're providing services across the country and growing every day. And if you see to the right, I just wanted to give you an example of some of our clients. We got our roots in Medicaid health plans. So that was, and it's still a huge part of our business, working with those Medicaid MCOs. But we also work with Medicare Advantage, some pharmacy work, and over the last year or so, have really started working with provider groups and ACOs. And that is a fast-growing area of our business. So I'm really excited about that. I want to give you some quick vocab just so that you know what I'm talking about today. So when I say digital communications, I'm referring to anything that's not snail mail. So an actual mailing would not count as a digital communication. So a digital communication would be a text, an IVR call, an email, using a chat bot, using any type of artificial intelligence, which I'll refer to as AI. Those are all digital communications. When I talk about a channel or a modality, I'm referring to one of those. Texting is a channel of communication. It's a modality of communication. IVR is a channel or modality. And another term that I'll use today is called nanosite, also called microsite. And if you're like me, I remember the first time I heard about them, I had no clue. Now I see them everywhere. But a microsite or a nanosite is like a mini website. It's a web-based page that opens just the information that you want the member to see. So an example would be a survey. If you send somebody a link, whether that's in an email or a text, and they click the link and it opens a survey, that's a nanosite. So we'll be talking about those a little bit today as well. So the first thing we're going to start with is, what are all those communications? Where's the opportunity for providers to connect with members and the types of communications that they do? So this wheel is an example of how our clients are currently using communication to connect with their members. And today I'm going to refer to members. So instead of saying patients, I'm going to say members. So, but it means the same thing, just so that we're all on the same page about that as well. Whether that's a new member welcome, somebody that has recently come and joined either your ACO or your group practice, welcoming them and letting them know what to expect and giving them contact information through preventative screenings, closing those care gaps, reminding them to take their medication and medication adherence, health and wellness, disease management, surveys, satisfaction surveys, or other health, health risk assessments, emergencies, notifications, like if you live in one of the coastal states or California, Arizona, where there might be wildfires, you may have information that you want to get out quickly to members. Another example of that would be letting people know that telehealth is available when your office is closed, which is something that came up a lot during COVID. All the way through to special events, like even saying happy birthday. All of these are just ways you can communicate with your members. So you can see from a provider's perspective, there is a ton of opportunity and ways to engage your population that you're taking care of. There we go. So another reason that I think it's really important is why communications from providers are so critical is that, this is just an example, 74% of patients reported a favorable providers. Only 60% of US consumers believe health insurers where 60% is members over profit. Now, I'm sure a lot of your health plan partners are in communications and trying to support you as a provider group or as an ACO as best they can. Obviously, I work with a lot of health plans, so I do know for a fact that they are out there doing lots of communication, and it is effective. But what we see from our ACO clients and our large provider groups is that really their results are even more effective. And I think this is why patients trust their provider, and they're more likely to do what you say over anybody else. So it's a real opportunity. So to back that up, I want to give you some statistics, just so you'll see why this is so vital. I'm going to talk a lot about texting today. I also am going to talk about some of those other modalities. The one thing we won't talk about is mail, because I think you've all been doing that and know how effective or not effective that is for you. But first of all, 98% of people own a mobile phone. This number has grown each and every year. In some age groups, it's 100%. So I think it's safe to say that we all communicate by mobile phone now. 95% of all messages are read within 90 seconds. Now, this is important for a couple of reasons. And this is one I really wanted to just talk a little bit about. There's two kinds of engagement. There's active engagement and passive engagement. So active engagement is when you send somebody a message, make a call, send them an email, and they respond. And that's active engagement. And that's great. And we try to actively engage members all the time. But there's also passive engagement. And that's when, even though they haven't actively engaged with you by responding, they still read the message. So your message is still getting across. And we know over time, the more time somebody sees something, the more likely they are to take action. So the fact that even passive engagement through text messaging, it's really impactful, essentially over time. We all know 75% of people don't answer a call from a number they don't recognize. I'm surprised that that's actually a higher number in reality. But people just don't answer calls when they don't recognize the number. 29% don't even listen to the voicemail. And another number that kind of surprised me, I thought I was the only one that didn't read all my emails, but apparently the average number of unopened emails is 200. And then lastly, just to address the concern about, still thinking that texting and using their mobile phone for communication is a younger age group thing. It's not. AARP has said that 90% of the 50 plus use technology for communication. And with each passing year, I'm a grandmother now, I realize that I'm getting into that higher age group, and I look at, friends my age and older, and even, parents of my generation. Yeah, we're all texting and using communication. And so what are patients saying? Those are some stats to show you, how relevant it is, and that it's a viable tool because there are lots of people using it. But what are patients actually saying? So there's been several studies, and I looked at quite a few of them, and wanted to give you some numbers here, that 91% report text as their preferred communication with their provider. That's a number that's gone up. I've seen previous studies where the number was lower, but with each year it gets higher and higher. 65% want text appointment reminders and pre-visit instructions. Great way to communicate with your patients, to give them appointment reminders, but also, do you want them to have blood work before they come to the appointment? Maybe remind them to make a list of the questions that they have so that they get the most out of their time with the provider and make the best use of that appointment. Or maybe you have questionnaires that you'd like them to fill out ahead of time. 75% reporting text as a helpful way to receive appointment reminders, delivery, and payment reminders. That was a different study. You can see this one showed a little bit higher from the people surveyed in that group, that they wanted those appointment reminders. And then I found this one particularly interesting. 53 complaints are regarding poor communication, not quality of care. So I think this speaks well that patients are pretty happy with the care. Generally speaking, they're pretty happy with the care they receive. The number one complaint is about how you communicate. So using these digital communications creates a real opportunity to improve that communication. So we decided to throw a couple of polling questions in so that you could be a little more engaged. And so Garrett, I'm hoping that this pops up for everybody. We're interested in finding out what your plans are around texting and if you've been thinking about it. So there, thank you, that's fantastic. So where would you add texting? I guess we've got, it flipped out a little bit. Where would you add texting to impact your ACO? I know it's a little early in the presentation, we haven't talked about all the ways, but in thinking about all those different ways that you can communicate, what would you do? Appointment reminders, care gap closure, disease management, member satisfaction surveys, medication adherence. So we'll give everybody just a second to answer those. Thought it would be interesting to see how people are thinking about using digital engagement, both currently and in the future. All right. So we'll give it just another second. All right. So hopefully those results will pop up to me here and I'll be able to share them with you momentarily. So how to design an effective communication strategy, and that's really the meat of this presentation, right? So what are those things to think about? Hopefully, oh, great, the survey results have popped up. So 40% say appointment reminders, 43% say care gap closures. That's what a lot of our clients definitely use it for. Disease management, comprehensive diabetes care, high blood pressure control, member satisfaction, and medication adherence. You know, it's funny, when we were putting these answers together, my team said nobody will choose medication adherence. And I didn't believe them, but you guys have proved them right. Medication adherence is the lower one. So that's excellent. Appointment reminders are really important, but those care gap closures, those screenings, those preventative reminders, getting all those HEDIS and STAR measures, absolutely. All right. Thank you so much for participating in that. I really appreciate that. And it's interesting to see the answers. And I hope it tells you something about what your counterparts are looking at too. All right, so when you're developing a strategy, you want to be thinking about with the end in mind. So what is the desired action that you want the member to take? I know these seem like basic questions, but I got to tell you time and time again, these are not necessarily how everybody approaches it. And this can make a difference in how successful your strategy is. What is the action that you want the member to take? I'm going to use mammogram as an example. So if your desired action is not to have them come into the office, right? Because you're not going to do that mammogram there. The desired action is that they get the appointment and they go get the mammogram. So as you're thinking about that, that becomes your desired outcome. The outcome obviously is people to be more compliant with their breast cancer screening and get their mammogram. But the action you want them to take is to the hospital and schedule it, or call to get it scheduled. You want that member to take, and it's not always be thinking about what's the actual action that is coming in. You absolutely want them to schedule an appointment and come into the office. Cervical cancer screening, chlamydia screening. All right, so think about the action that you want them to take, the outcome that you're looking for, and then how are you going to measure that? How are you going to know if what you put in place is successful? Sometimes it's really simple. We're going to see the number of mammograms increase. We're going to see the number of appointments for comprehensive diabetes care increase. We're going to see more people got their retinal exam. So be prepared to think about how you're going to measure that outcome and where you're going to get that data. Because as we're going to talk a little bit further in, you have to also be prepared to pivot when something's not working. And so you need a means of tracking that. And will it create the right member experience? Or I'll use the mammogram again. It's not the right experience to have them schedule an appointment to come in to have you tell them that they need a mammogram and then schedule it, right? That's not a good experience for you or for them. So be thinking about what's going to make the best experience for the member to drive that action and get that outcome that you're looking for. It sounds pretty simple, but I apologize. My computer froze. Oh dear. Well, I don't know what I did, but it worked. Okay. So types of outreach communications. I accidentally skipped right through there, but that's okay because this is a more interesting slide. So I mentioned to you early on that there were different types of digital communications. And so here's some of them, and here are the pros and cons to each one. First of all, there's texting. It's ideal for nudges and creating awareness and giving little bits of communication. I'm going to talk to you in a little bit about natural communication, And I want you to be thinking about how you use texting. You know, if somebody sends you a really long text, it's almost annoying because it's too much information. We don't want extensive amounts of information by text, but quick reminders, easy bits of information, absolutely. Ask a question, get a quick answer, sure. So there's a time and a place for that. The same with IVR and or robocalls or automated calls. They're great to reinforce certain things, but as you saw, you know, most people aren't answering the phone if they don't recognize the number anyway. And there's not much we can do to control that. So it's pretty frustrating. But there are times when sending a reinforcement message, it can be really impactful. Email. So email's a great example of when you have a lot of information to share with somebody. Maybe you've got several documents you need them to fill out. It's a more robust form of communication. So it's a time to use it when maybe there's more information than you could possibly fit into a text, and an email is more appropriate. I really like nanosite because they complement both texting and email. And like I said, it's a mini website. So for example, it's great for surveys, especially surveys. Now, a lot of times if you're doing a short survey, like only 2 or 3 questions, you do those right in a text. Ask the question, get the answer. But if you have 15 questions, that's too much to do over text. So you'd use a nanosite for that. Also, we use nanosites for disease education. Like we have a really great comprehensive diabetes program. We also have a maternity program called Bump to Baby. And we use nanosites for those, so that when we send those short text reminders, get your eye exam, get in for your A1C, there's always a link to the nanosite, which has the more robust information. So it's always available. So nanosites can be really effective. They're also a great way to compensate when you need secure information, because you can set up a nanosite to require user validation, like for date of birth, like last name and date of birth, or we highly discourage using member ID, but member ID is an example. You can require some kind of authentication. So nanosites can also be used when there's highly sensitive information. And lastly is a chatbot. Like when would you use a chatbot? That's great for when you get a lot of the same questions and it's very time consuming. So you can use a chatbot to answer those repetitive kinds of questions. And, it's an auto response, and it can be both put on a website, it can be used for inbound calls, any kind of customer service. And one of the things that we do here at HealthCrowd is, when we're working with our customers, this is part of what we do, is really talk about which one is the best one. And over time, of course, we've had, this is our area of expertise, so we have a lot of history and results from our other clients to actually know what works and doesn't. So we take a very consultative approach to make sure that we're sharing this with you folks as well. And if you have questions, I'm happy to answer them for you. Like if you just want to know, like you're doing this on your own and you have some questions, I'm happy to share with you some of our experience so that you can make some decisions. And I think this is probably, one of the most important slides here is, being really deliberate about choosing your outreach. So we talked a little bit about, starting with the end in mind and what action you're looking for and outcomes. And this comes into, so how do you choose the right channel or mode of communication? And ask yourself lots of questions. Are you adding a channel to improve outreach? Maybe you've been doing IVR calls and you're not getting a good outcome. Maybe you need people to pick up the phone when you're calling. So you could send a text and say, hey, we're going to be calling you and we'd like you to answer the phone. That's a great way to improve the effectiveness of your current model. Supplementing to drive more actions, reducing the services or needs of inbound call volume, increasing survey completion rates, whatever you need. As you ask yourself those questions, then you start thinking about which is the best mode of communication to create the best member experience, and also get the best result? What's going to be most effective and drive the outcomes that we're looking for? Will the member experience be consistent with existing channels? You know, I'm sure a lot of you don't have brand guides. Maybe some of you do. But you still want to be consistent with how you communicate as an organization. I'll give you an example. We have some clients that when we send a message out, it says, hey, this is XYZ company. And so you can see that's very friendly, right? Low key. But then we have others that are very formal and would never say, hey. It's always hello, good morning, good afternoon. You know, they're much more formal. And that's okay too, because you want it to be consistent with the kind of organization you are, because it will be reflected in your communications. So, you know, that's another little detail that I don't think everybody always thinks about, but it does make a difference. It also makes people feel like your message is more authentic when it's consistent with the kind of organization that you are and your current personality. Is it going to complement what we're doing, or are we just creating more noise? So I think about that more often with like email and IVR calls and mailing. It's like sometimes it's just like bombarding people with the same information, and more doesn't always mean better. Instead, it almost creates a numbing effect, and people are less likely to respond when they get bombarded with the same information from multiple channels, and they take it less serious. So it's really important to think about, you know, how effective that's going to be, and you don't want to create member abrasion or noise. And then, of course, as I always say, you know, how are you going to measure your success? And is this going to help you drive the results and outcomes that you're looking for? Now, this is another really important piece of your communication strategy. It sounds so simple, right? Couldn't anybody write a text? Couldn't anybody write an email? But I've learned, especially since my time at HealthCrowd, how challenging it actually is. But there's some golden rules that we follow. And hopefully this will help you improve your communications as well. We actually have a communications team, including a medical illustrationist on staff. I'll give you an example of why we would use an illustration over words. Trying to explain to somebody how to wear their mask properly is much more difficult than showing them a picture. If you can show them a picture and say, you know, it goes over your nose and over your mouth, and you know, nice and snug, that's a lot more effective than trying to explain that in words. So there are definitely times where we find illustration much more effective than words. But we have a content team, and this is what they specialize. They're writers, and this is their job. But they follow these rules. Is it timely? Is it relevant? And is it actionable? So timely means that person needs to do it now. Give you an example of a non-timely one is, of course, flu shots are big, right? I think every client we have does flu shot reminders, but we're not going to do flu shot reminders today in June. We're going to wait till flu season starts in September. So about September, October, that's when our clients start doing their flu shots reminders. So it's timely. That's when we want to get right ahead of flu season. And that it's relevant. You don't want to send out a mass message to everybody about getting a mammogram. You want to make sure it's targeted to the age group, the women, you know, and that applies to any, you know, healthcare screening that you might make sure it's relevant to that person. And so that not everybody gets the same messages. Targeting is really important. And that it's actionable. I don't know how many messages that I've seen in the past where people are really left wondering what they're supposed to do. And they kind of make that face like, well, what do you want me to do with this information? So you want to make sure your message is very clear, exactly what you want that person to do, so that they don't have any question what their next step is, and that, you know, they can comply. And lastly, what's in it for the member? Everybody wants to know, what does this got to do with me? Why does it apply to me? Why is it important for me? So if you can answer all of these questions, and you can think about this as you're creating a text message or an email or an IVR call, you're really going to improve the effectiveness of your messaging. It sounds simple, but you know, there's a lot of effort to get these messages just right. So I wanted to show you just an example of what texting looks like. We've talked a lot about the whole process and things. And so how does that all come together? So in this case, I wanted to show you an example of a new member welcome. And if you look to the left, it says, hi, Ruth, this is Acme Health Services, your health care provider group. And we're, happy to be able to serve you. And we do what we call a HIPAA light warning, which actually comes in the next message right before they receive their health screening. But we always give people the opportunity to stop. I'm going to talk to you about compliance here in a moment. And so we always get stop, wrong. We want to give them the option to let us know we've reached the wrong person. But in this case, you see, we've even given them the opportunity to add a contact card so that they do know it's you reaching out to them. All right, to the right, one of the things that I have found is that one of the largest groups that impact the quality ratings and star ratings of a lot of our clients is the attributed panel that's unengaged. So it is shocking to me how many people do not know who their primary care physician is. So maybe you want to tell them. So, this is Dr. Henry Gray. Our records show that you're due for a checkup. And if you need my information, type PCP, and then, the phone number comes up, the address, the hours. So there's lots of ways to be really engaging here. And as you can see, we've created a lot of impact with just a couple of short messages. So I know one of the hot topics is compliance and effectiveness, compliance in particular. So first, I'll explain to you about TCPA. Of course, I will default you. I'm not a lawyer. So, always refer to your own compliance privacy teams or, consult with your attorneys as appropriate. But just in general, TCPA says that you can connect with your patients. Health plans can connect with their members. If that person has provided their phone number to you, there's an assumption that they will receive healthcare related communication. So you can reach out to that person. What you can't do is you can't say to me, but I don't have phone numbers. So can you do a search for phone numbers? We can, but we can't use that phone number to send a text message. If you want to use a phone number that you found from the internet, you actually have to manually dial the phone and ask the member if you can contact them. So of course, we don't do that because that's really labor intensive and could be expensive. So we use the phone numbers that are provided, and we encourage you to continue to work on collecting phone numbers and emails so that you can do these kind of communications. But the other thing you can't do is you can't market them. So you can't say things like, hey, we've got these vitamins or BioFreeze or, you can't do any kind of marketing. It has to be a health related communication. So as long as you're sending a health related communication, that's all your care gap closures, your health related surveys, your screenings, office hours, you name it, that's all health related, including those birthday reminders are considered health related. The other thing that we do is manage the do not contact list for our clients. So, and this is something really important that you have to, if you're going to do this on your own, you have to track do not contact. So if somebody says stop or wrong, you have to make sure that you don't send them any further messages. So that's really important that you do that tracking. All of our message include a HIPAA compliant, what we call a HIPAA light warning that says, if you don't keep your phone secure, messages could be read by a third party. That's not actually required by law, but we think it's best practice. Gives people a heads up that if you don't want somebody to see these, either lock your phone and keep it protected, or this is an opportunity for them to opt out of the messaging. Now, I know one of the questions that you might be thinking is about the opt-in versus opt-out. We personally recommend an opt-out approach, meaning that assume that they want to receive the communication unless they tell you to stop, as opposed to asking them to opt in. anytime you ask people to take extra steps, you lose people. So, you know, opting in might be appropriate for some more sensitive type communication, but in general, we recommend the opt out. All right, so another part of TCPA is managing business hours. You want to make sure that those messages are going, you know, during reasonable time. One night I got a message at 9:30 and I was so irritated because, you know, like as I mentioned, I'm a grandmother now, I'm old. You know, after 9 o'clock, if somebody's texting me, it better be because there's been an accident. And instead it was just some reminder. I don't remember who it was from. And I was like, why are they texting me this late? And so, you know, we don't want to do that, right? Because we don't want to cause any kind of member abrasion. So it's really important about the times of day, not reaching out on holidays and weekends. And also, you know, we have some business rules around how many times we'll message somebody if we want a response. Now, we're not always sending a message asking for a response, but if we, you know, like if we keep sending somebody a survey message and they're not responding to it, we're not going to just keep sending and sending and sending because, you know, after so many times, they're not going to respond. So we usually put some business rules around those kinds of things. Like if we don't get a response when we're asking for one after 3 messages, we stop sending it. That depends on the communication because we've learned, you know, different communications require different amounts of contact. But I hope this is kind of helpful to you. I know I get asked about compliance a lot. All right, I'm going to try to pick up my pace a little bit here to make sure that we have time for questions. This is just an example to show you, you know, it used a test we analyzed with one client. This was a health plan client out of Tennessee, how many messages it took before the person actually closed the care gap. And, you know, one of the things I really love about this is that you can see pretty consistently, it didn't take a lot of messages to actually close the care gap. So in this case, CBP is controlling blood pressure, BCS is breast cancer screening. You can see comprehensive diabetes care, the A1C, nephritis. So this just gives you an idea that, you know, really texting has turned out to be a truly effective way, and it doesn't take a lot of messages. And so we base a lot of that communication on how many times we send out a message is based on how many messages we see before that person, you know, takes the action. In this case, some of them go a little longer because some of the appointments are harder to get. Okay. And just one other example, we had a client in Florida that had been doing a lot of communications, working very hard, and then they decided to add texting. So they changed the one modality. They actually cut back on their IVR calls and their other things. And they went to be one of the, well, they were the #1 plan in Florida because their rates improved so dramatically. They went to earn 26 out of 30 stars in 6 quality domains. It was truly impactful. So again, you know, I think texting makes a huge impact, and here's one of those examples. All right, we have another polling question, and as you can see, my slide's not the right one because I must have put them in the wrong order. But Garrett, if we can put that polling question up.
So this one, let's see. This one did not get added. I apologize.
All right, well then let's just move right along. That's no problem. That's okay. Those things happen. Let's talk about communicating in a natural way. So this is the last part of, you know, so we've talked about the pros and cons of all the different kinds of communications. You know, creating a message that's really impactful depending on the modality. So now I want you to think about communicating how you communicate. And we call this mirroring. All right, so when you're choosing a modality, sometimes it's as simple as thinking about how you communicate. And we put some really simple examples here. You know, like when I'm texting somebody, it's, are you ready to go? What time are you gonna be here? Do you wanna talk later today? You know, God forbid we actually pick up the phone without texting and confirming somebody will answer the phone. I don't even try to call my kids unless I've texted them first, because otherwise they think somebody's died. You know, so texting is great for, again, short snippets of information to drive the next action. email is great when there's a lot of things to look at, more information, more to read, etc. Maybe there's some documents that you need to include. And lastly is the call. Calls are appropriate when you need to, have a lengthier conversation. And so even using text to let somebody know that there's a call coming can be really helpful. So just try to use some common sense as you're setting these up, and it can make a huge difference. And again, sometimes I think these things sound really simple, but sometimes, we see our clients, get really complicated and not think about how some of these basic rules that really make a difference in how effective a communication strategy is. And this last one, I wanted to give you one more example. So I talked to you about nanosites and surveys, and even though it was one of the lowest on our polling, I actually get asked about it a lot. So to the left is an example of asking a question within a text message, where we want one or two questions, just some information. And to the right is an example of how a nanosite works. And again, I thought it'd be helpful for you to see a nanosite because they are pretty common and they're pretty useful used in the right context. In this case, the person clicks on the link and it opens a site to where they can answer those survey questions. All right, we're almost done. I wanted to share with you just a few outcomes. I'm watching my clock here for time. This is pretty good. I chose some where there was a great deal of effectiveness, but here was a group from California. In this case, they had multiple languages that they were dealing with, and they needed to increase their effectiveness. And so in this group, we added texting. This was the main change here, but we also included Chinese. So, that's another important thing I should have mentioned is, we do our communications in multiple languages. There's an ability for people to switch languages. We also keep our reading level at a 6th grade level. That's something really important that you should remember is that when you're doing communications, the reading level should be 6th grade or less. All right, but in this case, compared to the previous 2 years of results, they had significantly more engagement across the board for people going in for their preventative screening. Really, huge improvement. In this case, we looked at a Florida plan, and again, they were in a complicated situation. They were actually changing their name, and they were trying to improve their results. And as I mentioned, this is actually the one I had mentioned before. They, went to the top of their performance in their state for 2 straight years, and their HEDIS rates were significantly improved. This is the Well Child Visit, the Well Care 34, which I know that measure has since changed, but wanted to show you it based on what the results were at the time. And their Well Child and immunization, significant improvement. And the last one I'm going to share with you is a plan from Pennsylvania that, again, had incredibly strong results around their prenatal visits. So we're really pleased about this as well. And I'm happy to share more results with you that are, like if you have specific questions about, particular ones in, certain parts of the country. Lastly, here is a little checklist for you. These are some things that you can ask yourself as you go to create a communication and choose a modality of communication. And of course, I'm available to you. If you have questions, I hope you'll feel free to reach out to me because I'm happy to have a conversation with you. Obviously, I'm happy to tell you more about what HealthCrowd can do for you, but I'm also happy to answer your questions just so that you're getting, the best impact out of your communications that you are doing. Everybody's doing something, but we all want to do it better. And this is available for you. I'm happy to send it to you. And I think it's going to be available by download as well. All right, so I've talked a lot, and I want to give a few minutes to answer your questions. and then hopefully we'll be able to wrap up just a couple minutes early so you get a breather between phone calls. So Garrett, I'll invite you to join me to see if any questions have come up.
Great, thank you so much. Yeah, we did have a few questions that came in, so we'll, in no particular order here, we'll just dive in. The first question is a simple one, is how long does it take to implement a texting plan?
That's a great question, and something I probably should have covered as we were talking. An important one, like how much lift is it? What's involved? So I'm going to say it takes between like 8 and 12 weeks. You know, when you start, I know when we start working with a client, the first thing we do is identify what patients they want to do, and then we choose the right channel to do it, and then we draft up those communications. We write them up. We call them a script. So we create the script. And then we review that with our client, get any feedback, make sure it represents them and reflects them, that it's culturally appropriate, you know, the right reading level, includes the right languages for their organization, all of that. And then usually there's an internal approval. You know, I think that's probably the biggest thing clients don't think about when they start, is who all is going to be a stakeholder that's going to have to sign off on any of the next steps. And usually once they get started, then everybody hears about it and then more people want to be engaged. So thinking about who your internal approvers are, and that's going to give feedback. And then lastly is, you know, testing it and sending it out. And so that whole process can take, you know, I mean, once you get going and you've set it up, adding a new communication, you know, like adding more messages, pretty easy, but still takes a little bit of time. But I'd say in the beginning, somewhere between 8 and 12 weeks. From a data lift, you'll need to make sure that you are able to identify who has those open care gaps or who's in your target list, and be able to pull a file that has that information. So things like the name, their phone number, who their provider is, and what that open care gap is. It's not a lot of data, but you need to have those fields so that you can identify, and that will help queue up your system. So that's a great question. Thank you.
Great. Next question is, how do you include people who maybe don't have a mobile phone for texting?
That's another great question. So one of the things we do here at HealthCrowd is we what we call scrub the file. So we scrub it to see what's a landline and a mobile number, and if there's no number. So obviously, if there's no number at all, we look for an alternative way of communicating with the person. Maybe there's an email address, or those are the people that you're going to send the mail to. But if they have a landline, then we recommend an IVR call. But for anybody that has a mobile phone number, we recommend texting, IVR to those that don't. And that's the first step in every strategy. So you'll want to make sure that you look at that. But that's how we address that. If we have a mobile number, we text. If we don't, we use another modality. And again, thinking in terms of your communication strategy, this is something you want to be, begin at the beginning process. Make sure you have a process in place to capture phone numbers. I think most everybody does, but somehow the systems don't always talk to each other. So really important to be thinking about.
Okay, great. Moving right along, how do you safeguard patient privacy if using text or emails to communicate with patients?
What was the first part of that? How do we what?
How do you safeguard patient privacy?
So we have, what we call sensitive and non-sensitive types of communications. So for example, if we were going to talk about HIV treatment or something very sensitive, we'd probably do that by IVR after the person authenticated their identity. So we put something in place so that that person couldn't hear that message until they'd validated who they are. Now, through text, one of the ways that we have to protect privacy is through a secure nanosite. So we can let the person know that we're sending them a message about their health and ask them and click the link. And once they click the link, they can validate their identity and then see the information. So there are a couple of ways to make it so that the person has to validate who they are and authenticate their identity before they hear or see a message. But, I think that's why we have that HIPAA light warning, is to, let people know that we are going to be sending them health-related information and give them the opportunity to choose not to receive that. But most of the information is not considered super sensitive. A lot of it is around, that we typically see is around care gap screenings, come in for your appointment, healthcare reminders, things like that. So we don't necessarily have a lot of instances where they're like, I'm sending you your A1C results. In that case, again, we'd want to do something secure, like a secure nanosite, or doing it by IVR where they could validate their identity. So thank you for that question. I know the compliance and around TCPA and HIPAA are very important issues.
Yes. Okay, so we have time for one more question. And this question is, some of our providers email security codes to patients that they must use before they can access their patient portal for new notices. Is this a good strategy?
So the data is kind of mixed on that. I know portal use is certainly growing amongst all providers, but it's increasingly, the studies that are being done are showing people don't like to go to portals or apps. And so I think that's why the texting as a direct means of communication is more effective. I think patient portals are still going to have their place. Like our last question about, private information, test results. Having people go to a portal to get those results is probably still going to be the best bet. Texting them to tell them that they have information at their portal, a great way to drive them to the portal. But forcing people to communicate always through some kind of third-party application has been increasingly shown that people are resistant to doing it. There's less utilization, and they do not prefer that. So I think that's one of the reasons why just sending a direct message with the information is so effective. It doesn't require any additional steps. And for years we've always known this. Anytime you ask people to take any extra step, each step along the way, no matter what they have to do, no matter what they have to complete, anytime there's a step, you lose a certain amount of people. So I think it depends on what you're trying to communicate is going to be the answer to that. If it's just to tell them to come in for their cervical cancer screening, I think sending them to a portal is a long way to get there when there's much easier ways to do it. But if you're sharing them the results of that screening, then I think the portal definitely has its place. So that's a great question. Thank you for asking it.
Very good. Well, unfortunately, that is all the time we have for questions. We did have a few additional that came in. We simply don't have time to get to them. But if you asked the question and we didn't answer yours, we will get back to you via email. So please keep that in mind. And we definitely want to hear from you. So go ahead and continue to ask your questions during this time, and we will get back to you. As we close out here, I wanted to encourage you all to visit the HealthCrowd exhibit booth today, or whenever you would like, at the ACOexhibithall.com, and that's where you can interact with their team. You can learn a lot more about them and what they're doing, and there's a lot of great resources there. Also, this is at the ACO Exhibit Hall in the library is where we're going to house and archive this webinar, so you'll be able to refer to that and to access that whenever you would like. And finally, if you have any specific questions for Ms. Maynard or any of the HealthCrowd team, Her information here is on the screen, so feel free to reach out to her directly and she'll be able to answer any questions and have any further discussion that you would like. So thank you all so much for attending. Thank you, Jackie, for your time, and hope you all have a wonderful rest of your day. Thanks for coming.
Thank you so much, everybody.